Ready when you are, Shauna. All right,
I'm good.
let's do it.
Welcome, everyone. Thank you for tuning in tonight. We're here to update you on our community's reopening, our public health response, and to answer local questions. Tompkins County has shown incredible resilience in the wake of this pandemic, and I want to thank you on behalf of the county legislature for staying apart, connecting in new and virtual ways, and for wearing masks as a sign of respect to each other. This weekend is usually a time where we gather to pause and reflect on the heroes who have sacrificed their lives while serving in the US military. As you may have heard, the governor has announced that ceremonies with limited gatherings will be allowed, and while there may be some tributes, flag raisings, and small parades this weekend, this announcement does not apply to personal gatherings of families or friends. If we continue to stay apart for now, we will be together again soon. I know that many of us are facing our own personal struggles as we are more isolated, frustrated, and discouraged by this crisis. Please know that there are people to talk to, resources for you and your family members, and support systems in place to help keep you healthy and safe. We'll post a link in the chat with local mental health resources, but please know that you are not alone and our community is here for you. As this has been the first week of our phased reopening and we move forward in the southern tier, I want to invite our county administrator, Jason Molino, to share some updates from the local emergency operations center and the regional control room managing the COVID-19 response.
Thanks, Shauna. Thank you, and thank the entire legislature. And also thank you for reminding us of the Memorial Day ceremonies are to be limited, and that they need to continue to stay distanced, and they have a reduced number of people, meaning they can only have no more than 10 people around them so that we don't hurt our loved ones. But thank you for that good introduction. Also, I want to express my thanks and gratitude to our mental health professionals in Tompkins County, including our own mental health department, for being a constant and compassionate resource for our community. Services are still available. They've been available, and they will continue to be available. We're finding new ways to connect with those in need. And even if you've never had mental health services before, we want you to know that it's okay to reach out and ask for the support. And don't forget, we're all here for each other. So thank you very much to the mental health professionals that are doing a lot these days and continuing to carry and support the community. Just a few updates from the regional control room, and then I know we have a lot of questions. And a reminder, everyone, these regional control room discussions happen every day. They're updates from the region, as well as our state counterparts. Usually get clarity, or at least get to ask questions, hoping for clarity. For example, learning about religious ceremonies. So religious ceremonies are now allowed with 10 people or less, of course, with face coverings and good social distancing, but they've also authorized drive-in and parking lot services for those that are looking to expand or to continue to provide religious ceremonies. So we are able to ask a lot of questions, get some clarity, and as we get more information, we'll continue to pass it down, and this forum is another venue to do that. Two things I just want to talk about briefly. One is enforcement. So enforcement, as we go through the phase openings, is going to be a key component of ensuring safety. But I want to preface that with personal responsibility is the first measure of ensuring safety for everyone. So as the weather gets nicer, people become more eager to get outside. We have seen an uptick in our calls to our dispatch center, environmental health line, as well as 211. We can't enforce every little incident that goes on, which is where maybe there isn't a mask or a facial covering being worn, or there's not good social distancing. So we continue to do our best to inform the public. We're going to continue to push messaging out, but we also want to remind folks, they are an important part and they take a huge responsibility in being able to protect each other. So again, my mask protects you, your mask protects me. Enforcement and business, again, what we learned today through the regional control rooms, this week, was that businesses will play a key role and an important role to enforcing mask wearing and social distancing in their businesses and organizations. It will be part of their reopening plans and part of their guidelines, and they will be attesting that they will continue to ensure and comply and ensure that patrons as well as employees, are continuing to comply with mask wearing as well as social distancing. And we are going to continue to communicate this message out to the public on a regular basis as part of our messaging. Again, if businesses and nonprofits need masks for employees, because it now is an employer's responsibility to provide those masks, please request them through a form that we'll post in the chat as we go through this evening's conversation. Just so you know, we've distributed over 60,000 masked individuals throughout Tompkins County to date. And it's on all of us to wear our masks. It's on all of us to continue to be an important part of that reopening. And in full circle, the more we wear our masks, the more we prevent the spread of the disease and control it, the more likely we are to move to phases 2, 3, and 4, which will only be a success for our community. I want to recognize some of those individuals that are unable to wear masks, and this kind of, for medical reasons, kind of reminds us to have courteous and respectful dialogue and conversations with people when we talk about mask wearing and approaching individuals. Some folks, for medical reasons, can't wear masks. We appreciate that. We respect that. And we just want everybody else in the public to remember that as they go through their day-to-day activities. Tompkins County Health Department, particularly our Environmental Health Division, as well as our County Sheriff's Office, in partnership with other law enforcement agencies in the county, as well as code officers and building inspectors, will continue to work on the complaint process and answer questions. We have a procedure in place. Our first and foremost priority is going to be educate individuals, educate the public, educate businesses, organizations, so that we can minimize the amount of enforcement needed and we have compliance. I guess we'll move on to before we move on to questions, Sean, I just want to introduce the folks that we have around. We have Amy Hendricks, who is our Deputy County Administrator and is the EOC Commander in charge of the incident. We have Frank Krupa, our Public Health Director, and our Mental Health Commissioner, who has done a great job in supporting the community through this. And we have everybody's favorite department head, Jay Franklin, who is our County Assessor and has been reassigned temporarily, not foregoing his assessing duties, but has temporarily been assigned to the EOC for the past 10 weeks or so, acting as a planning chief and a key component to the success of our planning and ultimate execution in the county. So I'll throw it back to you, Shauna, and we got a bunch of questions.
Thanks, Jason. Frank, this question is for you. What have we seen since we've started to reopen?
So the good news is we have not seen a lot of new cases. It's still fairly early in the reopening phase. Remember, when we talk about incubation period, it's between 2 and 14 days. But it's also important to note that a few cases is not going to delay us moving forward or potentially move us back. What we're concerned about as we move forward is whether or not our hospital system is able to provide care to individuals. So it's okay. We're taking all of these steps. We're continuing to do contact investigations and contact tracing whenever we do find a case to limit exposure. But we just want folks to know that as we might see some cases here or there as we reopen, it doesn't mean that we're going to immediately stop moving forward or go backwards. So we're in a good spot. Everyone continues to help us by following the guidance that's out there. And if we continue to do that, I think we're on a good path.
Thanks, Frank. The next question is for Jason. Can you provide some details on how we'll move from one phase to another?
Forgot about that. A good question, getting this question a lot, and there is not a set structure to it, but I'll say this, that the purpose of monitoring the healthcare metrics, the things like Frank just talked about cases not increasing, the important piece about monitoring the metrics on a daily basis, and the public can watch those metrics, those 7 key metrics on the New York Forward webpage, is that as long as they don't change drastically, as long as they continue to be maintained and we stay within those milestones, we have a very good chance of graduating to the next phase and the next phase. Frame wise, right now it would look like as if we can maintain in the current phase that we're at for 14 days, no changes or significant changes in our healthcare metrics, then we would be well positioned, whether it's the next week, the next day, not really sure yet on how the state's going to work with that, but we would be well positioned to move to the next phase and the next phase. Where it would be challenging is if we start to see a spike in cases, spike in hospitalizations, ICU admissions, then I think it's going to be more of a prolonged process before we be able to go to the next stage.
Great. Can you tell us when are we scheduled to move to phase 2? And also what's included in phase 2?
So again, if everything were to work out well, it could be as soon as next week for phase 2. We'll wait and see what happens with that. There are several industries that have been outlined so far, and we're expecting much clearer guidance and more specificity in the next few days. One of them includes professional services, and I know there's been probably the most common question we get is hair salons and barbershops are included in that first industry. So Jay, I know you've been asking, hair salons are in the first phase. Retail is another one, which again is a big one. Administrative support and real estate and rental and leasing. So those will be expanded upon on the New York Forward website. They have some expansion now, but they'll be detailed more in the near future, probably in the next few days. It's important to recognize that these industries will be operating differently as guidelines around density, distance, face coverings, and hygiene will still apply. And as we're able to interact with other people around these industries, we'll be able to talk a little bit more about the specificity of how those guidelines are different. But that's roughly right now some of the industries that are expected to open in phase 2.
Thank you, Jason. Frank, this question is for you. Do we have any further guidance on gatherings?
Yeah, it's been a popular question, and you and Jason both mentioned the Memorial Day weekend is coming up, and there has been guidance released that official Memorial Day ceremonies can have 10 or fewer people participate in those. And it's important to point out those are official ceremonies. Those don't happen in your backyard. So, we understand this is a big weekend for folks, and it's going to be a challenge to not get together, but we need a bit more time as we move forward to this. So we're encouraging folks to continue to keep those distances. We also got guidance about religious ceremonies or religious settings, and those are now allowed to be done with 10 or fewer people using all the social distancing and face covering rules as well. They're also allowed to do parking lot and drive-through type services as well, as long as folks remain in their cars. So we are getting the opportunity to get together in smaller groups in these very particular settings. But beyond that, we're really still asking folks to stay with their family units, celebrate that way, recognize the people that gave their lives for us, but do it in a little bit different way this year so we can keep moving forward.
Frank, the next few questions are for you. Who should get tested, and is there any new guidance on testing that you can share with us?
Yeah, good question, Shauna. The criteria don't change, we just add new groups. So it's really important to start with that anyone that's not feeling well, that has the symptoms that we've been outlining all along, they should go get tested, right? We want to identify sick individuals as soon as possible so we can begin to isolate and do the contact investigations. After that, those close contacts of a known case, so if the health department contacts you during their contact investigation and says, you were a close contact, we'll be asking you to go get tested at that point. And then essential workers are able to get tested. We've been doing that for a few weeks now. And then we recently added phase 1 workers. So anyone that's going back to work now as phase 1 has reopened, they are eligible for testing. We've had a couple of other kind of targeted groups, nursing homes and assisted living facilities. The people that work there are now mandated to be tested twice a week. And so working with Cuyahoga Health Systems, we're looking to make availability for those individuals to get tested. And then for preoperatory needs, right? So before you can have elective surgery, there is a testing requirement. And so those folks are eligible as well.
Thank you. Frank, when does someone have to be quarantined?
That's another good question, Shauna, and I'm going to take a little bit of time because there's some nuance to this. So in its most basic sense, we quarantine individuals that are healthy, that don't have symptoms or have not tested positive, but that have been exposed to someone, whether it's a known case or in a situation where we're unable to necessarily identify everyone. We may ask for those that were in a particular space at a time to quarantine. Where we get a lot of questions is related to the expansion of testing. Early on in this process, if you got tested, because it was limited to people that with symptoms and those that were close contacts, we asked you to quarantine until such time as your test results came back. So that would still stand for those individuals. If somebody's sick, they need to isolate until they get their test results back, and then beyond that. If someone's a close contact or has been told by the health department that they may have been exposed, we ask those folks to quarantine until their results come back, and then even beyond for the 14-day incubation period. Where it gets a little bit different is when we start talking about essential workers, and then others, in phase one. So for essential workers, if they are exposed and they're not symptomatic and they do get tested, we ask them to quarantine except for when they need to go to work. They are still eligible to go to work. We would just want them to quarantine during the other times they're away from work because they're essential and we need them to be at work. And we work with them through the nurses to make sure they understand what that means and to try to answer their questions. For others that are beginning to get tested, like pre-operation or phase one workers, where when they get tested, if they're asymptomatic, they're getting tested simply because they're in this new pool of people that we've open tested up to. They don't need to quarantine while they await their results, right? So if your sole purpose for going to get tested is, as a worker, whether it be at a nursing home or, in one of the phase one businesses, during the time that you're waiting for your result, you do not have to quarantine. So that's an important distinction. I know there's been a bit of confusion about that, but it's a nuance as we've opened this up to more categories of people to be tested.
Thanks, Frank. Jay, this question is for you. Is there an update on county operations reopening? And what will our departments be considering as we move toward a new normal that other businesses and organizations should also be considering?
Thanks, Shauna. I wouldn't say that county operations will start reopening because we have been open ever since this pandemic started. But starting on June 1st, on Monday, not Memorial Day, but the week after that, we're going to start reopening our doors to the public, but not in the same sense as what we always did. We're going to try to limit the density of both our staff coming back to the office. We're going to try to limit the density of our clients and customers that will be coming in so that we can maintain that social distancing kind of within our office. All of our employees will be wearing masks, so people shouldn't be surprised when they do come into our office and see somebody. We may be behind a plexiglass screen, but we will still have our masks on. We're going to be wiping down all of our surfaces at least once an hour and probably after every transaction as well, just to make sure that we're hitting those four pillars of density, face mask, personal hygiene, and
distance.
That 6-foot distance. So that density helps us create the distance there. But that type of things are the same things that all of the other businesses should also be looking at as well. Maintaining that distance and trying to reduce the density while they're still trying to work through their businesses as well.
It's great. Thank you, Jay. Jason, these next few questions are for you. What should someone do if they want to make a complaint about a business not following guidelines or community members gathering?
So we've gotten this question quite a bit. Our guidance when it comes to businesses, we would encourage them to either call the environmental health department, and we can post that number as part of our comments here, our chat line. or the non-emergent line. So we can put those numbers up. If it's community members gathering, it would also be the non-emergent line. And from there, based on resources available, we'll be able to follow up. Some of it will be that day, some of it won't be that day, depending on when the call comes in and available resources. So that's the best way for people to file a complaint.
We've also heard of some concerns about partying and large gatherings. What should we be sharing with our constituents?
So, that can fall into the line of community members gathering. I think that's where, the call to the non-emergent line could be helpful and we can follow up. It's something to also keep in mind with folks that sometimes large gatherings may also mean those are folks that are living together. They might be in similar settings. So it kind of comes back to the respectful dialogue or discussion piece of things, not to be too judgmental and assumptions. And again, the underlying, I think, element and message we want to get across is that everybody's taking personal responsibility. So if people are gathering and they're maintaining their social distancing and wearing their face masks, that's what we want to see if that's the case. But again, there's supposed to be, at this point, no large gatherings.
If folks are in a park or on a trail and can keep their distance, should they still wear a mask?
Another very good question. I think what our advice is they should have a mask with them. The executive order states that if you cannot maintain a 6-foot distance, you have to be wearing a mask. And I think the approach we're taking is well, unless you can guarantee that you won't be breaking that 6-foot barrier, you should have a mask with you. And so if you're on a park, if you're on a trail, should you have a mask with you? Yes. If it's just you on the trail and or it's someone with your housemate or someone on those lines that you've been isolating with or quarantining with, that might not be necessary to wear it, but you can't dictate or determine what's going to happen as you're on that trail or in that park. So having the mask with you, readily available to be able to wear, is something that we're encouraging everyone to have.
Thanks, Jason. We have many more questions that have been submitted by members of the public, and I'm going to invite Deputy Administrator Amy Hendricks to pose those questions. If you have any other questions, please add them to the chat, and Dominic will ensure that they get in the queue.
All right, thank you, Shauna. So I have quite a few questions and I know more are starting to come in. And so we'll start off, Jason, talking a little bit about the regional control room. And if there are specific thresholds for each metric that we should be watching for that would close the valve. So is there a specific number of cases that would have to come in 2 weeks' time that would keep us in phase 1 or even move us backwards? How does that really work?
Sure. So each milestone has the threshold, or each category, I should say, or metric has the threshold on the chart, so to speak, that's on the New York Forward webpage. I don't have it off the top of my head, but those metrics are identified. They're generally rolling averages over several days. And again, they're region-wide, so it's just not for the whole region. I would say the first sign that may be a demonstration that we may be resting or having a harder time maintaining it would be the number of positive cases. I would imagine that, and Frank, please jump in, the number of positive cases would then lead to hospitalizations, which then would lead to ICU admissions. So in terms of watching a metric, it would be the first one you're going to want to look out for is positive cases. And if you start to see positive cases slowly creep up in the region as they get closer to that metric or that milestone, I apologize, I don't have it off the top of my head, then you're going to start to understand whether or not this is going to be a little bit of a prolonged effort, or that we're going to stay in that phase, or if there are other actions we may have to take as a region to slow that expansion or the spread or the increase of that metric. Frank, do you have anything to add to that?
No, I think you hit it well. It's, we want to monitor cases first because that'll be our first indicator. But the number of cases isn't one of the measures in the dashboard. It's really about cases getting severe enough to need hospitalization and then ultimately ICUs. So we may see cases fluctuate over the next few weeks, but our important goal is to hopefully keep those folks out of the hospital and have them recover quickly.
Great, thanks.
All right. One of the pieces, and I'll let you guys decide who wants to take this one, is how are we assessing the rights and responsibilities of the stakeholders including businesses and patrons, as we start to go into these reopening phases and changing how we're doing things? How do we ensure that we are respecting those rights and responsibilities? Who wants to jump in?
I'll start, Frank, then you can pick it up. So how we're assessing it, again, we're going to come from the perspective of everyone has ownership and responsibility. Every individual, whether, every individual, every resident, every business owner, every employee, every patron, if we take the perspective that my mask protects you and your mask protects me, and we all embrace that, all understand that, and are conscious of what we're doing, then the responsibility falls on all of us. And I think that's the safest approach to it. From an employer perspective, if you're an employee and you're an employer, you don't want your employees coming into work sick, period. Because if they come in sick, they have the chance of spreading it not only to further employees, which is going to hinder your business or organization, but also to patrons or customers or clients. So again, there's a sense of personal responsibility in that element, and that's the message we want to continue to push.
Yeah, and Jason, as the public health director, my responsibility is to protect the health of our community. And with that comes some pretty significant authorities that can impact individuals' rights. And I don't take that lightly. And that's the reason that our messaging has been so much targeted at personal responsibility, because to date, we haven't had to use that authority, right? We've been able to talk to our community and say, this is why, we need you to do this. It's so we can protect ourselves and the most vulnerable amongst us. And people have been responsive. And that's really what it's about, is as a community deciding that we want to do what's necessary to protect those folks that we care and love about in our community. And folks have done a good job with that, and we're hoping that they will continue.
Great. So as we start thinking about our restaurants and getting back to that, are we considering closing streets or allowing restaurants to place tables outside their restaurants or adjacent to their establishments so you could pick up and maybe go outside or eat, kind of use them a little differently? Frank, do you want to take that one?
I think there's all kinds of creative ideas are being considered, and some of that will be decided at the local municipal level, such as closing roads, those kind of things. I think they'll be looking for guidance from us and from the state about when it might be appropriate to do that. We're all for creative ideas that fit within the phased approach and follow the guidance that are going to protect against the spread of disease. So certainly, if people have ideas and are thinking through those things, we'd encourage that, because we do want to get people back to the things that they know and want. We just want to make sure we do it in the safest manner possible.
All right. Jason, do you have anything to add in there?
I think Frank got it all.
All right. Who is monitoring our downtown musicians and buskers on the Commons and in other places? Do they need to be masked? And how do we ensure that, kind of our street performers and others are maintaining distance and respecting these things? Frank?
Yeah, the good question, Amy. I think you asked, should they be wearing masks? If they can't ensure that folks are not going to get within 6 feet of them, then yeah, we would encourage them to wear a mask. But in situations like that, as an individual, I have the power to stay 6 feet away from those folks, right? Or anyone that's not wearing a mask. So from that perspective, as an individual, I have the ability to take steps that will protect me by not being too close to somebody that might not be wearing a mask. So I think, again, it all goes back to that personal responsibility. Certainly, if there's going to be a conversation about it with anyone not wearing a mask, we want to be respectful, as Jason has said many times. Most often when we've had a conversation, people understand, and as human beings, when we can talk one-on-one about why we think something's important, hopefully that gets us to an amicable solution, and we can move forward.
All right. And Frank, I think this is more for you as well. How is enforcement of food vendors and restaurants handled during this time, and how is food safety and cleaning enforced?
Our environmental health division, Jason was talking about them before, is the group that's been handling complaints and some enforcement. They do that on a regular basis, right? They are the regulatory arm of the health department, and they permit food service establishments and do regular inspections to make sure that they're doing things in a safe and healthy manner. Obviously, we've curtailed those inspections, understandably so, both to protect our staff and also because restaurants aren't operating to the same levels that they have been. But in any instance, we have been communicating with them throughout this, sharing with them the guidance that has come out. And certainly if we get a complaint, we'll investigate that as we always would have. So we've got a team of highly skilled sanitarians that do this kind of work all the time, and they've been doing it throughout and will continue moving forward.
All right, thank you, Frank. Jay, this one I think you can answer. We are talking about signage that businesses could be putting up to encourage customers or clients to follow guidance from the county and the state. And we've been doing some of this here with our operations. So can you talk a little bit about what signage businesses should be using?
Yeah, our county health department has done a great job creating some signs that are available on our Moving Forward website that I'm sure the link will be quickly put in our chat box. But those signs, which list those 4 pillars that I couldn't remember before, will be there for you or for that business to print out and to prominently display to talk about distance, density, cloth masks, and personal hygiene. So that will help remind individuals to, the more times you see things, the more it will actually register. You know, even though I've seen that sign hundreds, thousands of times, you know, the more you see it, the more it's going to register. The more we can keep that at the forefront, the more we can keep moving into phase 2, 3, 4, and get back to that new normal.
All right, thank you, Jay. On the cloth mask wearing, Jason, what are some ways that businesses can enforce mask wearing, and can they refuse service to people who don't wear a mask?
This question came up earlier with our chamber panel, and I know the Chamber of Commerce, the Tompkins County Chamber of Commerce, as well as the DIA and TCAD are working on some guidance to assist businesses on how to address these can be somewhat challenging conversations. And I think the best advice we can give folks is that they should really think about how they would address this, how it would be unique for their specific business or their specific organization, how they want to approach it and address it, and then keep in mind respectful conversation and respectful dialogue. Again, not everyone can wear a mask. There may be some folks that can't for medical reasons, so we want to be conscious about that. There's also other reasons on which they might not be able to. So I think our advice to folks is to think about a strategy and a strategic way to approach how you're going to address those individuals that are not wearing masks. It is something that they're going to have to attest to in order to reopen as part of their reopening plan. And I know our economic development and our small business partners are going to be working with them and having some workshops coming up on how they can help and assist in developing those elements of those plans.
Thank you, Jason. And Frank, I'm going to ask you to respond to this next question, probably putting on your other hat as the mental health commissioner. Have you seen an uptick in the mental health needs in the community? And who can a person reach out to if they need to connect with someone?
Yeah, it's a great question, Amy. We had a call earlier this week with the local providers of mental health services that could talk about this exact thing. The mental health department and Family and Children's, the 2 big clinics in town, our numbers, our new intake numbers are not where they were before COVID. So we haven't seen a big uptick. Where we have is our suicide prevention and crisis line has seen a significant increase in call volume. And they do an excellent job, and they're really good about referring folks to us. But what we really want our community to know is you don't have to wait till something becomes a crisis to seek for help. We're going to put in the chat box a link to all of the different providers that are available in the community, and they are all operational. They've done an amazing job of switching to telemedicine and are serving their clients and are accepting new clients. So you don't have to wait till you need to call the crisis line. Certainly do call if you need them, but please reach out to the Mental Health Department, Family and Children's, Mental Health Association, or others that are in our community, and we'll post a link to contact information for those organizations.
All right. Thank you, Frank. Jason, I believe today there was new summer school guidance issued. Can you talk a little bit about that, and then any changes to summer camps? I know that's always a question that's been coming up quite a bit recently.
Yeah. So new summer school guidance did come out. It's going to be remote. It's not going to be in-person summer school. So that's going to be up to school districts as how they organize that with their students. So that did come out. We were expecting and still may receive some guidance with summer camps. To be honest, I think it's this is my opinion only. There's a challenge with this right now with some of the new medical information that's coming out with about younger people and how this may be impacting younger people. So the governor was very, I think, purposefully made some purposeful comments about trying to make decisions based on the information and getting the full information before rushing decisions. So while we don't have any direction on summer camps, there's probably a delay due to these recent developments with our youth being impacted a little differently by the disease. And the only thing I can say is that it's a question that comes up daily. It's a question we face daily. It's a question the regional control room feels daily. So it's definitely on the forefront. And I'm hoping that we'll have some guidance within the next week or so.
All right, thank you. It is getting warmer. This is a very popular weekend to kind of kick off the summer months, going to campgrounds and beaches. Frank, can you talk a little bit about the regulations around campgrounds and beaches and what we're doing here in Tompkins County?
Sure. Let me go back to your last question you asked me first, Amy, because I'd be remiss if I didn't also talk about the substance use disorder providers in our community.
Yes.
Right along with the mental health group. They are operational addiction and recovery services, the Alcohol and Drug Council. They've done a great job as well shifting to new models, and they are open and ready to help folks. So if you're dealing with a substance use disorder and want to get help, they're there and available, and they're on that same list that Dominic's posting in the comment list. But to talk about beaches, the governor did allow beaches to open if they chose, mainly related down to the metropolitan area with the other states in that region and trying to coordinate. And that did apply to us. And our environmental health folks have been communicating with our local beaches. I don't believe any of them intend to open. They have not asked to have their permit issued. So right now, I don't believe any local beaches will be open. As far as camping, we have been allowing seasonal camping to occur in RVs, and we are now beginning to allow RV camping for shorter stays in campgrounds as well. Again, RV only because they're self-contained. There's less need for common spaces and other amenities that might be at a campground. So we're trying to be reasonable and understand this is a big weekend for camping, but we ask folks that if they do partake in camping at a local campground, they follow the rules set forth by those campgrounds that have been approved by the health department, so we can help keep everybody safe.
Great, thank you, Frank. Another question that has come up quite a bit is youth masks. Where can people find masks for children and smaller faces, I guess, and how do they get those? So Frank?
Yeah, another great question, Amy. So first of all, always have to start, anyone 2 or under should not be wearing a mask. It's not safe for them. So we want to make sure that we're just talking about 3 and up. We don't have necessarily on hand at the EOC children's masks. Many of the community masks that are being made are made with ties, which are adjustable, that would be able to fit a child's head. The face covering part might be large because it's designed for an adult, but there are ways to do that. And or a parent, if they have some sewing skills, could take a larger mask and adjust it. But it's about creativity. There's some videos on our website on how to make a cloth mask for your own with just a piece of cloth and rubber bands, which is something that could be adjusted to be child size. So folks are going to have to be a little bit creative as they do that. But again, we don't want anyone under 3 wearing a mask.
Okay, thank you. And Jason, would you know if essential businesses, they've been open for this whole time, do they need to attest and have opening plans in the same way that the new businesses coming in on phase 1 and phase 2? How does that work?
This is definitely a question we've had multiple times. The short answer is yes, they do have to develop a reopening plan, and yes, they will have to attest to it. However, the state has not opened that element or that portal on the New York Forward website, but it should be forthcoming. Regardless, I think a lot of essential businesses probably already implementing a lot of these best practices. And my suggestion to those essential businesses is to get a jump start, look at some of the existing templates that are online. There's a lot of the criteria that is very similar, and start to develop a written plan that if you haven't already, and be prepared for when you have to do it. You'll just be that far ahead of the game.
Right. So as we start to look at phase 2, I know people are getting excited, starting to develop their plans and thinking about how they're going to prepare for this and the future phases as well. So as we start to look at businesses that you have peak periods of customers, for example, a restaurant at lunchtime, how should they start to prepare their business and their plans for those peak hours? Jason, you want to go for it?
I'll try it. I mean, I think it's unclear at this moment if there's going to be a slow, gradual move from a limited capacity to a full capacity. And I think restaurants and similar type of establishments should probably start to think about what would a reduced capacity look like versus full capacity, because you have to keep in mind that the whole purpose of the multi-phased approach was to slowly graduate into, from a very low density environment to a eventual more dense environment. So, that's why certain things are in phases 4, that like social gatherings or concert venues or even casinos, right? Those are going to be a phase 4 element of that. Why? Because the element behind the business is that there's a tight group of people in a small area gathering, which is hard to spread apart. So I think the advice here is that be prepared for a gradual, maybe a limited capacity at first and a gradual growth into full capacity.
Okay, thank you. Jay, since you've been working on our groups again, how should businesses be staggering times that their employees work, or should they consider changing their hours to limit peak times? What should businesses be doing about that?
Yeah, thanks, Amy. This is a question I get a lot, both from employers and also from retail establishments as well. So yeah, we should definitely look at staggering times people are coming into the building so they're not congregating in the entryways or as they're putting away their lunch. We should also stagger lunches, because that would also alleviate some of that pressure on our food establishments. If everyone goes to lunch at 12, those places are going to be overwhelmed. So we can look at ordering lunch together in order to try to alleviate some of that pressure, picking it up on their way into work. There's many different ways that we can look at trying to extend that lunch. Not everyone needs to eat at lunch at noon. You could eat lunch at 1 to 2. And hopefully with staggered schedules as well, not everyone's going to come into the office at 8 o'clock and need to eat at noon. Maybe they can come in a little late, a little bit earlier. And the more we can do to change our social norms of when we need to eat, when we need to come into the office, that's going to help reduce that density, increase the distance, and be able to not overwhelm some of these retail establishments that themselves are struggling with. Peak time at some of our local places was always a crazy time as it was. So if we can kind of eliminate that pressure, they can focus on keeping the density in their stores down, keeping up their hygiene, their cleaning processes as well. And then we'll all be safer as we move on.
All right, thank you, Jay. Do we have any guidance, Jason, on multi-tenanted buildings? So where there are multiple departments, agencies, organizations, businesses all under one roof. And what are their obligations regarding attestations and safety plans and how that works? What phase would that be part of? How does that happen?
So I think it's safe to say that any business is going to be required, or any organization is going to be required to have a reopening plan. So in that instance where you might have a tenant of a business inside an existing building, both are going to be required. Probably the best way to search that is there's a tool on the New York Forward website where you can search by the NAICS code of the business, and then they can tell you whether or not it's a what phase they may fit into. I don't have a specific answer for multi-tenant buildings, but going on the New York Forward website, searching by your business code will be able to tell you what phase you would fit into, or possibly what category industry in that phase. And then from there, people should be able to move forward.
All right, thank you. Frank, I think this question came in regards to some of the other questions you answered about the support of the community, and in particular, when will support group meetings, I know many have gone virtual, but when will they be able to resume and have kind of their face-to-face AA and other recovery meetings together?
Yeah, I think we're still virtual for a little while longer, right? As we navigate through this, it is challenging because inherently groups are designed to bring that camaraderie together and shared experiences to, help the recovery process or support those that might need it. So we're not quite there yet. I do believe our local organizations have taken great strides to try to make the services available in a new format, virtually and otherwise. So folks should reach out if they need help, reach out to those organizations to find out what type of help is available. You don't go without, because you might think they're not doing something a particular way. Call them, they want to help. And they'll talk you through what's available and hopefully get you the support and help that you might need.
All right, thank you, Frank. There have been some changes about gatherings as far as for religious services or faith-based services, as well as for these official Memorial Day ceremonies. In light of that, what guidance do you have for the community and those faith-based organizations as they bring those very small 10 and under gatherings together? Frank?
Yeah, there's the four pillars that Jay was referring to: density, distance, face coverings, and personal hygiene, right? Every situation as we go through these phases, those four things need to be a part of everything we do, right? So every time a new opportunity to move forward in a phase presents itself, those four things are the place to start. We've got to make sure that we're keeping our numbers down. If we're going to have 10 or fewer people, we still need them to be at least 6 feet apart. We want to be wearing face coverings whenever that's not possible. Washing hands, cleaning surfaces that are commonly touched. All of that is what's going to make these reopening efforts successful.
Great. So the Community Foundation and others are starting to talk a lot about gratitude. And so before we close up with a final question, I'm going to ask this one, and then we'll have one more for Jason and Shauna, and we'll end tonight. But for the first one is on that gratitude piece. What are each of you grateful for or thankful for in this time? Frank, do you want to kick it off?
Sure. There's a lot of things. Family. I have not been home much in the last few months, and without them and their support, my wife Andrea and daughter Lily, my parents and others that I talk to from afar, without their support, I wouldn't be able to do what I've been doing. And I consider my team, both here at the EOC, at the health department, the mental health department, they're all part of that extended family too. And I'm just so grateful that everyone has been extremely supportive, checking in to make sure that that I'm okay through all of this, and offering different ways to support the effort. And so I'm grateful for all of that and all of them, and I really appreciate that.
Thanks, Frank. Jay, what are you grateful for?
Yeah, I'm gonna have to echo Frank. My wife Dixie has just been absolutely amazing, allowing me to spend all of the time here at the EOC. You know, my kids, Curly, Boy, and Blondie, or I mean Reese, Troy, and Jillian. Sometimes I get their names mixed up, but you know, they've been great here too. You know, going through fourth grade or the end of fourth grade and trying to um, learn and still get their studies done. You know, that's been a challenge for my wife, trying to manage those three. You know, everyone at my normal job at the assessment office has been great during this time, you know, and just allowing me to focus on the duties here at the EOC and trying to help plan whatever we need to do next to continue moving on and moving into the next phase. It's, you know, I have a lot to be grateful for.
Thanks, Jay. Jason.
Yeah. You know, I will echo what Jay and Frank have said. You know, my wife, Anna, our 4 children, Sophia, Stella, Charlie, and Jason Jr., my extended family that sometimes tune into these programs and then harass me afterwards. It keeps you going. You know, the amount of time we've committed to this event over the past 10 weeks, 12 weeks has been enormous. And my wife being home, there's consecutive days where I leave in the morning and I don't see them, and I come back and I don't see them. And she's been able to hold up shop at the house, teaching 3 kids in 3 different grades is just near impossible, but she continues to do it and to work with the kids, and their support and their love is forever there, and it's what keeps you going, really. As you know, staff and the folks in the EOC, everyone on this call, you know, they have made it possible, I think, for us as a county to succeed. Being reassigned to different duties over the past really almost 2-3 months is remarkable. The resiliency that I've seen from staff across the board has been reassuring. And you know, the notes and the emails of a few words and a few sentences of appreciation just make your day. And I've seen that really come out of the woodwork. And it's been you'll have days where it's tough, and you'll get a note from someone that, you know, I might see every once in a while, or not even, and I don't talk to them, but they'll just say, hey, thanks for what you're doing, and we appreciate it all. So those moments are really thoughtful and really supportive. And last but not least, for sure, the legislature has been incredibly supportive of all of us. Our chair, Leslie McBean-Claiborne, has been going through this twice almost as a city department head, as well as the county legislature chair. And without, I think, their empowerment to do our work, it would be difficult to achieve what we have. So a lot to be thankful for, a lot to be grateful for.
Thanks, Jason. Shauna, what are you grateful for?
I am equally grateful for such a competent staff that we have with our county. The constituent feedback that I receive is everything from Frank's office to how quickly and easily testing was set up, how wonderful our public health nurses are, how compassionate, how empathetic. I mean, the list goes on. And it's not just with public health, it's with mental health. It's with every situation that has come forth since COVID. I've received nothing but praise from my constituents. So I feel like I can tell these stories and they just keep coming. And it's really nice to hear that feedback. And to be an elected representative, giving you guys that feedback, because it's not always that way. I'm also very thankful for my family, my wife, Margot, and my 3 kids, Graham, Emerson, and Keen. And I mean, there's some positives to this. Yesterday, I was able to take a nice long bike ride with my family in the middle of the day, and that would have never happened. So I'm trying to look for those positives and you know, think of ways for us to keep busy and also to keep safe.
Thanks, Shauna. I think we all are fairly grateful for the community as a whole as we start talking about the family and the friends and the others that are coming together through all of this, and our staff and everyone. So I appreciate those words. I have one final question, and
What are you grateful for?
Oh, I didn't answer?
So you're the one that's always asking these questions. Let's kind of turn the table here a little bit.
Wait a second here, Jay. You're not supposed to go rogue. I'm grateful for pretty much everything you guys said for family. I'm really for having an opportunity to work with such a kind, caring, and competent group of people here in the EOC, as well as throughout the county and the community. I think we have a very active community that has high expectations, but they also stand behind their expectations and are willing to work with us. So I'm grateful for that. I'm also really grateful for the sense of humor that we have been able to maintain here in the EOC, and I watch you all laugh. But I think that's a big piece of this, is maintaining our spirits and counting on each other. So when we're having a rough day, having people that have your back. And I feel that not only in our own operations, but throughout the county and out throughout the community. So there's a lot to be really grateful for. So I'm going to have one final question. I'm going to ask both Jason and Shauna to respond to, and I think it feeds into some of this gratitude piece, because we talked a lot about the connections we have with family and friends. What are some things that people can do to continue to connect with friends and family when we really do all want to be together? You know, there was a discussion yesterday about how much grandparents are missing being able to hug their grandchildren right now. What are ways to connect when we want to be together, but we still have to stay apart at this point? So Jason, I'll start with you, and then Shauna, I'll let you respond as well.
So we have a pretty large extended family, both on my wife's side, and we were very close, very close, that every Sunday we would drive to Buffalo to watch the Buffalo Bills games with all the family. So, and 13 nieces and nephews, and there's a big, long family, and there usually doesn't go 2 or 3 weeks where we don't see them, and now we've gone I don't know how many months without it. So there's several things we've done. Phone calls and FaceTime has a new meaning. I think we do it as second nature. My phone lights up because apparently everybody in my family has nothing to do but to text all day to every single one of us. So as annoying it is, it's reassuring that we're keeping in touch with folks. Something that I also try to do is try to take some time during the week to call some of those relatives that I don't speak to on a regular basis. Just let them know what's going on. It's a 5-minute conversation, and you get it in return. And I think those are key pieces of just keeping in touch with folks. For us, that's what we've been able to get through with our family, and that's what's worked for us.
All right, thank you, Jason. Shauna, what has been working for you, and what are suggestions for people how to connect while staying apart?
I think Jason had some great recommendations. My daughter actually had a drive-by birthday party the other day, and we all got in the car and we waved out the window, and it was just a really nice gift for her friend to see her after not seeing her for 2.5 months. And it was fun. It was fun for the whole family. I drove my bike by Deborah Dawson's house the other day. It was nice to see a colleague I haven't seen in months. It's the little connections that I think really make a big deal right now. And, it's not normal for us to be alone and not to reach out. And so if it's a matter of making a phone call or doing a drive-by and staying in your car, I think it's worth it. And I think, sometimes just reaching out really does make the difference.
All right, Shauna, I'll hand it over to you to wrap us up.
I want to thank everyone for joining us this afternoon. We hope that you have a wonderful Memorial Day. We will be hosting another session next Thursday at 5 p.m. and we hope that you will join us. Have a safe holiday. Thank you.